teachers and my dear colleagues. Today, I will be presenting on nephrolitheasis. Our objectives will be to study the epidemiology, constituents of renal stone, types and their etiology, pathogenesis, risk factors, Unani theories, and pathogenesis according to Unani system of medicine. Nephrolitheasis. Nephro means kidney and lithesis means stone. So it's a kidney stone and is also sometimes referred as urolithesis or renal calculi. Nephrolithesis or urolithesis is formation of urinary calculi at any level of the urinary tract. It is a first known common type of the renal disease after UTI and prostate disease. Commonly seen in United States, South Africa, India and Southeast Asia. Around 240,000 and 7 lakh to 20,000 Americans per year are affected by this disease. The ratio between the male and female is 2:1. That means the male is affected twice more than the female. It is most common in areas of the high humidity and elevated temperature. Peak incidence is seen in second to third decades of life. Constituents of renal stone. It is basically comprises of the uric acid, cysteine, struvite, calcium oxalate, and calcium phosphate stone, which makes up about 75 to 85%. Types of the renal stones. Most common type is calcium stone, which is seen 75%, and among the calcium stone, it can be seen as a calcium oxalate, which is about 50%, calcium phosphate, which comprises of 5%, and a mixture of calcium oxalate and calcium phosphate, 45%. Coming to the etiology of the calcium stone, the first cause which is seen is the idiopathic hypercalciuria without hypercalcemia. In this, the normal blood serum calcium level there is a normal serum calcium level, but the calcium is excreted out in the urine, and the cause is unknown, and it is seen mostly in 50% of the patients. The second cause is hypercalcemia and hypercalciuria. There will be increased secretion of the calcium in the urine, and there will be elevated serum calcium level, which is seen in some of the conditions like primary hyperparathyroidism, and as we know that there is irregular overproduction of the parathyroid hormone, which leads to the increased calcium absorption in the kidney, and which leads to the increased level of the serum calcium levels. And sometimes it is seen when there is defect in the bowel absorption, which is known as the absorptive hypercalcemia, and if there is a defect in the bowel, then it is known as absorptive hypercalciuria. 50% of patients have hyperuricemia, and 25% have idiopathic calcium stone disease. Here also, the serum calcium level is normal, but sometimes they have the familial history of the renal stones. Coming to the pathogenesis, there is an imbalance between the degree of supersaturation of ions forming the stone and the concentration of inhibitors in the urine. So there is a precipitation of these ions, calcium oxalate or calcium phosphate. Some of the predisposing factors are also the alkaline urinary pH, or maybe due to the decreased urinary volume, increased excretion of the oxalate and uric acid. Morphology of the stone is seen that it is small, ovoid, hard, granular by surface, dark brown due to the old pigment, and this old pigment is due to the it causes the injury to the urinary tract, There is a bleeding, and this bleeding is deposited in that stone. This is the calcium oxalate. Coming to the next stone, it is also known as steroid stone, triple phosphate stone, and sometimes the infection stone. Sorry. About 50% of the urinary calculi is made up of magnesium, ammonium, calcium phosphate. Etiology is urinary infection with the urea splitting organisms like proteins. Pathogenesis is alkaline urinary pH is produced by the ammonia. This ammonia is produced by the bacteria. जो बैक्टीरिया जो है वो रिलीज करता है यूरियस एंजाइम, ठीक है, ये रिलीज होता है, it is converted into the ammonia and this ammonia leads to the alkaline urinary pH. Morphology is it is seen as yellow, white or grey. It is soft, friable, irregular in shape, and if it will take the shape of the renal pelvis, mostly it is large, solitary, and then it is known as staghorn stone. It is a type of the stone. Uric acid stone. It comprises 6% of the urinary calculi, and it is mostly due to the hyperuricemia with or without the hyperuricemia seen in primary and secondary gout. Sometimes in hypersuric administrative of the hypersuric drugs such as probenecids and salicylates, and also seen in myeloproliferative disorders, example in leukemia. Pathogenesis is it may be formed due to the acidic urine if the pH of urine is below 6. It will causes uric acid solubility decrement and it will favor its precipitation. Morphology is the stone is smooth, yellowish brown, hard and multiple. Cystine stone. It is less than 2% of the urinary calculi, and mainly it is genetically determined defect in the cystine transport. Cystine urea, the pathogenesis of the cystine stone is that these are the least soluble cystine precipitates. It's a natural occurring amino acid which precipitate as the cystine crystals. Morphology is it is a small, round, smooth, yellowish, and wax. Risk factors. There will be a family history of kidney stones, primary hypothyroidism, as we have mentioned earlier, is seen, and the third is hypertension, gout, vitamin A deficiency, semi-cooked concentrated acidic food like bread, excessive intake of oxalate-rich diet like black tea, cocoa beverages, spinach, beetroot, orange juice, consumption of beer, less physical activity, obesity, antacids, usage of low diuretics, vitamin C administration in large doses. Clinical manifestation. There will be a colic pain in the upper region, hematuria, dysuria or burning menstruation, urgency, frequency, and this is all due to the जो स्टोन है वो यूरिनरी ट्रैक से पास डाउन होता है, वहाँ की एपिथेलियम में इंजरी करता है, ब्लीडिंग होती है और वहाँ की समटाइम्स देयर विल बी इन्फेक्शन. अगर वो इम्पैक्ट हो जाएगा स्टोन तो पीछे यूरिन का आउटफ्लो ऑब्स्ट्रक्शन होगा और वो इन्फेक्शन कॉज करेगा यूरिन में. देयर विल बी नॉजिया, वॉमिटिंग, फीवर एंड चिल्स. यूनानी concept. According to the Unani medicine, the morbid material and stagnation of this morbid material are responsible for the urinary calculi. It is mainly produced by the Wallis of serum. It can be a fresh milk, concentrated milk. These all dietary items are not easily digestible. Stomachae खुलिया हो सकता है, वर्मी खुलिया, ज़ोफर होते गाफिया, खुली खुलिया. ये जो है एक प्रोटेक्शन कॉज है जो हसाते खुलिया के लिए रिस्पॉन्सिबल है. काबिल सलाह में जानेमूस में ये कहा है कि अगर रीनल स्टोन का कॉज जो है खुरमुखी हो सकता है किडनी में, अगर उसका पस बन रहा है वो पस जो है वो इजीली पास आउट नहीं हो रहा है, वहीं पे जमा होता जा रहा है, कंसोलिडेट होके वो एक स्टोन जो कि शक्ल इख्तियार कर लेता है। और दूसरी बात उन्होंने कानूनी सुनना में ये भी बताई गई है कि ये एल्डर पीपल में ज़्यादा मिलता है, क्योंकि पहला कि उनका जो मिजाज होता है वो वालिद रकम होता है, और दूसरा जो है उसमें हल्के बलगम जो होता है वो एक्सेसिवली प्रोड्यूस होती है, और ये हल्की बलगमी जो होती है इस जो अलीज मादा है जो है उसके लिए रिस्पॉन्सिबल होती है। और क्योंकि ये भारत मिजाज के होते हैं एल्डर पीपल, तो वहाँ पे जो उनका यूरिनरी ट्रैक्ट है वो नैरो डाउन हो जाती है, वहाँ पे तंगी हो जाती है, और उस तंगी की वजह से भी कभी कभी जो है ऑब्स्ट्रक्शन कॉज हो जाता है, और जो स्टोन्स हैं वो इजीली नहीं निकल पाता, वहीं पे वो सेटल डाउन प्रेसिपिटेट हो जाते हैं।
स्लाइड पे आपने कहाँ से दिया है?
यूरिन सर्विस
और सारा से किया उसमें देखा आप इसका आपको
उसी के अंदर थोड़ा सा डालेंगे, उसमें मेंशन कर रहे हैं
अब सुना में ये मत बोल के डालेंगे उसमें कब सुना में ऐसा कहा अब सुना का से है ना, लेकिन आप समझ पाओ अब सुना में कैसा है दारू उसमें इसके बारे में क्या यही कंफ्यूजन होता है कि कब सुना दारू इसका ही जो है
According to Ibn kidney stone is formed by the active power, which is known as Mohan, which will raise the temperature inside the kidney. ये जो है हरारत बढ़ा देते हैं, Mohan जो है हरारत बढ़ाती है। He also stated that stone producing matter or lithic matter is viscous and sticky substance, which may be either phlegm or viscous blood or pus. When this expensive power of the kidney becomes weak due to the altered temperament, inflammation or ulcer, then in spite of excreting out, it will retain in the dialysis of the kidney. This lithic substance is dried by the active power of the kidney to form the crystal and gradually become the stone. क्योंकि इसमें एक दूसरे ने ये बात कही कि एक ये यूसेज सब्सटेंस होता है, मात्रा होता है, बड़ी मात्रा होता है, जो कि टेम्परेचर जो है हरारत जो होती है इसको इस मादे को सुखा देती है, ड्राई कर देती है, और फिर यही धीरे धीरे प्रेसिपिटेट होकर स्टोन की शक्ल इख्तियार करती है। Abbas Majusi states when more concentrated humors and highly viscous fluid get into the calcium of the kidney, these humors and fluid will be dried up by the high boiling temperature to form the crystal, and after some time it will gradually result in stone formation. According to Ibn Zohar, when the kidney is unable to excrete out the thick humors due to the weakness, and the least these humor will be deposited inside the kidney as a result of layer by layer crystallization stone is formed. According to Zakaria Razi, the cause of this disease is abnormal humors, and the body excretes the abnormal humor in the form of viscid fluid, which move towards the kidney and form crest that cause the stone formation. Pathogenesis is intense heat, अगर शरीर हरारत है, कोई मरीज खिल है, यूरिनरी ट्रैक्ट की तंगी हो जाए, कभी कभी जो मात्रा है मात्रा दलीज मात्रा है उसमें लजूजत ज़्यादा हो जाए, या फिर वहाँ पे खून के नतीजे में बस बढ़ जाए, और कभी कभी बस और ब्लड के मिक्सचर से भी जो है स्टोन फॉर्मेशन होता है।